Hello, we're here at the American College of Rheumatology annual meeting here in Washington, D.C. in 2016. I'm here with Dr. Erika Darrah. Dr. Darrah, tell us about some of the research you're presenting here.
Great, yeah. Tomorrow I actually have the opportunity to present our work in an abstract session, which means they chose our work to be showcased for a short presentation. And what I have the opportunity to present is our new work on a new biomarker that we identified in patients with rheumatoid arthritis. And it really builds on our past work. In the past, we identified that a subset of patients with RA actually have a circulating biomarker in their blood that identifies patients who are at the highest risk for the most erosive joint disease and actually lung complications as well in RA. And so now the new work I'm presenting actually identifies a different biomarker that identifies a completely different subset of patients. These patients actually have the most mild disease, the most mild joint disease, the most mild lung disease, and have some really interesting features that really set them apart from kind of the average RA patient that we think about. And so the opportunity to identify patients with very different disease trajectories is really important to be able to predict which patient may have more severe disease and which patient may have more mild disease early on. And this could really impact the choice of treatment and the way patients are monitored by their doctors.
Sounds very promising. How could this lead to better treatments in the future?
Yeah, I think the ability, with RA, the disease is so diverse. Different patients experience their disease very differently. And so as such, they also respond differently to a variety of medicines. And in RA in particular, there are so many medications that are available now for doctors to choose from and for patients to decide what medicine to take. And so any ability to identify distinct patient subgroups that may have different disease outcomes early in disease could really impact what treatment a patient decides to take, how aggressive the treatment should be, how early to prevent disease damage and accumulation of damage throughout their disease. So it could really help to impact the way that treatment decisions are made.
Thank you for the important research you're doing here, and all the best to you.
Absolutely. Thank you.